This morning I'll be interviewing Dr. Bonta Hiscoe, who's a longtime Lansing resident. He came here more than 50 years ago, first as a thoracic surgeon, and after many years he also became the first health maintenance
medical
director of Lansing. I believe it was called Health Central. Am I correct on that, Doctor?
Right, absolutely.
He's seen many changes in the years he's been here. For instance, how has the delivery system changed in the years that you've been practicing here in the Lansing area?
Well, at the first of it, we were, the doctors were mostly general practitioners, or even like a surgeon was a general surgeon that did a lot more than just one specialty. But gradually over time, specialties have come in, and the way medical care is paid for has changed dramatically and influenced what's happened. So basically, we've gone from a very collegial community to one like other communities where everybody's sort of taking care of themselves and not as group-oriented, if you will. We've gone from 2 hospitals, which were the Social Center for Medicine, St. Lawrence and Sparrow. While I was here, Ingham Medical, which was a tuberculosis sanatorium, changed into a general hospital, which is now Ingham Regional. And Lansing General was a house on Townsend Street when I first came to town.
On Townsend Street?
Yeah, they had just a house, and it was called their hospital, and then they built a unit on Pennsylvania Avenue and became a real player in the hospital business. So we went from 2 hospitals to 4 hospitals, and then as the economy changed and the games they play in medical care, we went back to 2 hospitals when Ingham and the osteopathic hospital merged, and then Sparrow and St. Lawrence merged.
Mm-hmm. How has the medical society changed in these years?
Well, back in the early days, the doctors used to do free medical care, or they'd get paid a very small amount by the county to take care of indigent patients. And that money the medical society decided rather wisely, I think, to put it all into a pot, and that was a county medical society fund that financed dinners and so forth, and so they had good turnout and a very good relationship. That when Medicare and Medicaid came in 1965, things changed. Nobody had to do anything for nothing anymore. County didn't pay for health care, and gradually when those funds were used up, everybody sort of went their own way, and the social custom today is not to belong to groups nearly as much as they used to, and so their attendance at the medical society is down, but it's true in the Bar Association too. So,
what about what is technology? Discuss a little bit of the technology that you've seen over the past 50 years.
That's kind of wild.
Probably kind of impossible to cover.
Well, it can be broken down into 3 parts, actually. I've done some thinking about it. And in the science side of it, I mean the basic science side of it, we used to talk about gross organs and rearranging how your gut worked, sewing them together to try different ways. And we knew there were cells, and we studied them in med school. But now, the science has progressed to the place where, they're going at the anatomy of the cell and biotechnology and biochemistry, so that we're down on the molecular level, and we have the DNA stuff, and so we've learned huge amounts of the basic fundamentals of life and disease. And then the other part of technology is the gadgets we've developed, the MRIs and the CTs and the scopes that we go in all kinds of orifices to look at, so we don't have to cut them open as much as we used to. And then one of the huge things people don't think of as a medical tool is computers. And computers have made a lot of difference, and they're going to make a huge future difference. You've heard Obama talk about electronic medical records and so forth, and that will change the way medicine is practiced. But one of the basic things computers have done is patients now have information. When they used to go to the doctor knew everything and the patient knew nothing. Now the patient can look it up on the computer or the net. And so the balance of power is much more even than it used to be, as long as patients are careful about the resources they use, because some people are very gullible and get into some weird stuff, but there's good information on the net that people need to use.
In other words, patients today are encouraged and also do look out for themselves.
Well, they're more sophisticated, yeah, and I think it elevates their expectations, and I think that's good for the practice of medicine. In the long run, we have to, as medical director of an HMO, we tried to identify quality and quality medical care, and when you got down to it, it was a very kind of fuzzy thing. And at the first of it, was the doctor used to say, well, it's because I said so, and that's not a very good thing to base it on. So we've been evolving over the last 30 years or so. One other thing that's happened in Lansing that I think made a huge difference is that we had right in our front doorstep 2 medical schools started. They started the College of Human Medicine in '68, and then the '70s the Osteopathic College came in, and that had a huge influence on how things went and created a lot of tension between the community doctors and the university doctors.
And that's, the doctors, and of course, what about LCC? That's more in the nursing,
that
educational thing that
well, yes,
grown greatly over the years.
Oh, and contributed a lot. And the days when we didn't, we're short of nurses, they're a vitally important contributor. And the dental hygiene, and I'm a big fan of community colleges. I think they fill a real need in a community. And part of that is in the medical community, that they do dental hygienists and surgical technicians and EMTs and all that.
Well, you have retired in a way, and yet you haven't, because you're now a medical examiner, having gone from surgeon to medical healthcare director, administrator, to now you just don't stop.
Well, it keeps you part of what's going on a little bit, and Dee needed a little help down there. At least she was glad to have me go down to the health department. So I do some medical examiner work, and that's where I'll be going this afternoon, as a matter of fact. But it's a lot paperwork. We have some nurses that go out, and we work with the Sparrow Forensic Pathology Department. But it does keep you attuned to what's happening, and sometimes what's happening in the newspaper.
Right, and things, we know that.
Yes, ma'am.
Well, thank you very much for speaking with us this morning.
All right.
And we'll talk to you later.
Fine. Thank you much.